Hi, Dr. Richard Hughes. How are you?
I'm well, and yourself?
Thank you so much for asking. I'm doing well.
Good.
I want to having the interview with you, but first of all, I want to say thank you for joining the American and joining us for medical billing and to help you to grow your office financially and help your patient using Medicare and medical health insurance to for claim for reimbursement. So I have few of the questions that I want to ask you. Have you ever done in medical billing before you met me?
I have, Leanne, and it did not work out well. Let's say it that way. And I put down medical billing for a number of years in my practice. I got so disenchanted. And it was during COVID, and I went to seek to get a cataract surgery, right? So I'm in the doctor's office, and they appoint me for surgery. And they could tell me exactly what I had to pay to them and the surgery center. So it dawned on me, so well, gee whiz, these other people that I worked with, they could not give me a straight answer for any claim. And I had a series of inconsistent claim results for the same procedures. So I found you on YouTube with an interview with Dr. Rosen. And I thought, well, let's give this a try again. And I've been favorably impressed so far. And your instruction that you gave today is beyond belief. I've never had any kind of instruction in that depth in these last 2 days for any kind of medical insurance or dental insurance billing processes. So I thank you very, very much.
Oh, you're welcome. It's my pleasure to have you join in our journal to into the medical billing for your office. May I ask you, in the last 2 days, what is the topic that you think is the most important and interest for you the most into what you learned?
Well, I think the most.
And the value also what is the value of that into
Okay. What was most important, what interested me the most was one, the sequencing and the elements that we need for each part of the claim. That was most intriguing. And then your portal, where we could dial in and know exactly what the patient's responsibility is and what Medicare or the medical insurance will pay. That was extremely impressive, very impressive indeed. And that's something we can implement tomorrow, which is Monday.
what is you learn on this course about the procedure you think that is you haven't heard it before that is a medical necessity that is covered and you want to tell to other dentists about it at this.
Well, I had no idea that we could charge for periodontal treatment or endodontic treatment. Had no idea at all through medical insurance. None whatsoever. I was very familiar with implant procedures and bone grafting procedures, but the periodontal and the endodontic procedures is just an eye opener.
How about the one that is which we open fractures or non-union fractures or something that you heard those
Never,
diagnosis and
never,
procedure
never,
before?
never.
So those procedure and diagnosis is meaning we see it very often into the patient radiology report and onto the pathology report with the soft tissue infection lesion as well. So that's why is as long as we having medical necessity that support into radiology report and pathology report. On top of that, we also want to implement to using oral ultrasound for the further diagnosis. And also we want to using saliva for testing for HPV and oral bacteria to helping support stronger to your documentation and diagnosis when you're using medical insurance for claim for reimbursement.
I can't say anything more. You nailed it.
Yeah. Thank you, Dr. Hughes,
And
so
thank you
much
very
for
much,
that. Thank
Diana.
you,
Thank you
Dr.
very much.